Hi, and welcome to this lecture on weight management for breast cancer survivors. We are going to be talking all about the role of stress management today. So I'm going to share my screen and we are going to get into it. Okay. And thank you for bearing with me while I have a little coughing situation today. But all right. So today we're going to talk about weight management for breast cancer survivors and specifically the role of stress in weight management. So if you don't know me yet, I'm Jess Cording. I'm a registered dietitian, health coach, and author. I also happen to be a certified Pilates instructor and Reiki practitioner, and I bring a little bit of everything to my work. I've also worked extensively with breast cancer survivor patients and those at high risk to help them improve their quality of life through diet, exercise, and other healthy habits. So this is part 7 of an 8-part lecture series. And we put this together because we believe it's really important to take a comprehensive approach that incorporates mindset, nutrition, movement, taking hormonal shifts into consideration, that we're addressing things like sleep, stress management, and mental well-being. It's all part of the picture. So while we'll mostly be talking about avoiding unintentional weight gain in breast cancer survivors today, this presentation is meant to be inclusive of all breast cancer survivors and those looking to reduce their risk. So some of the things we're going to cover today. So the role of stress in weight management, some stress management essentials, nutrition and stress, lifestyle habits for stress management, how to create a stress management plan that will actually work for you. And additionally, we will talk about how to find support if you need it. Okay, so what is stress, right? Stress, if we want to define it, is a feeling of emotional or physical tension. And it can come from events that we're experiencing or witnessing. It can come from thoughts, some more internal. And stress can have a really big impact on our health and well being. Something that I want you to know is that there's actually a few types of stress. So sometimes you'll hear the expression good stress and bad stress. So good stress, aka eustress, this is actually a type of stress that's been shown to have a beneficial effect on motivation, performance, well-being. Think of it like running a race or like nailing a presentation. It tends to be short-term and it feels exciting and positive. And then on the flip side, we have stress or distress, you might look at it as. And this is the type of stress that has a negative effect on health and wellness. So when there's distress going on or this negative stress, hormones released include things like adrenaline and cortisol. And those can have, in the long term, they can have a negative impact on health. And distress can be acute, episodic, or chronic. Okay, so if you're like, okay, what does that mean? So acute is the short-term stress. So this stress, it won't affect your health too much if you have the tools to cope. So think of it like you have an unpleasant interaction with another driver on your way to work. Um, Episodic stress is when we experience acute stress too frequently. So maybe you take the same bus route to work every day, and the driver is just really cranky and you always have a negative experience, and then that becomes an episodic stress. Or maybe you're going through just a challenging time in your life. There's just like a situation that is causing stress, but it's not a super long period of time. Now, chronic stress is more long-term stress. So this is what can have significant effect on health. So sometimes we're aware of when we're chronically stressed, sometimes we're not. Chronic stress, for example, that might be if there's an ongoing situation for like months, years. Maybe you find yourself in a caregiver role, or maybe your experience of being a patient and going through treatment is really, really stressful, and which is completely valid and understood. Or maybe you have a child with special needs, or you're in a work environment that's really toxic for you. All of these things can contribute to long-term stress. I also want to point out that sometimes things that we generally think of as positive stress can become negative. So for example, if talking about exercise, we know that exercise is one of the best things we can do to reduce our disease risk and boost our mental health. But there is a sweet spot. Too much intense exercise, for example, over a prolonged period of time actually can put stress on the body and impact metabolism in negative ways. So there's a lot of different types of stress, a lot of different ways stress might show up. But I just wanted you to be aware that there's different levels of stress and different types. So I've shared this information on other presentations in this series, but in case this is the first one you're tuning into, I just wanted to share a little recap of just some important things that we should keep in mind regarding weight management for breast cancer survivors. So there are metabolic changes that occur related to treatment frequently, such as changes in hunger hormones, leptin and ghrelin, which play a role in being aware of when we're hungry and when we're full, insulin resistance, inflammation, decreased physical activity, and loss of muscle. These are all things that can impact metabolic rate and weight management by extension. Hormone changes related to treatment. So, for example, medically induced menopause or so use of an aromatase inhibitor or experiencing cycle changes, menstrual cycle changes related to tamoxifen use. These are things that can impact weight management in a variety of ways. So medication side effects, that could be things like fatigue, sleep disturbance, joint pain, mood changes, things of that nature. And then, of course, mental health concerns. So the stress of treatment or, it being in that high risk category, and trauma, of course, we have to acknowledge these things. So just to dive a little bit deeper into the metabolic piece of the picture, because this will come into play later in this presentation, but some of the most common metabolic changes related to breast cancer medications and to chemotherapy are things such as changes in glucose metabolism and insulin sensitivity. So by this, I mean, you might see on your blood work some changes like elevated A1C or elevated fasting glucose. And then we sometimes see decreased insulin sensitivity, meaning that the cells don't respond as efficiently to insulin when our body releases it in response to carbohydrate intake. So in short, our body can become less efficient at processing carbohydrates. We may also see changes in lipid metabolism. So by that, I mean things like you might see on your lab work, higher levels of cholesterol, particularly LDL cholesterol, the quote unquote bad cholesterol, maybe higher triglycerides. It's also just worth pointing out that this increase in lipids, so in cholesterol, triglycerides, it may actually be linked to the changes in how our body processes glucose, just because both of these processes are involved in energy metabolism and meaning how our body uses what we eat to make energy. And it's all processed in the liver. So if the liver is under stress or is impacted by medications, that can influence how effective these processes are. And then I touched on this briefly, but changes in leptin levels. So leptin is a hormone that is, it helps us be aware when we're full. It's a satiety hormone, if you will. And so leptin really helps with regulating hunger levels, which can be really important for supporting weight maintenance, right? But what happens when the body's functioning properly, leptin suppresses appetite until, someone needs to eat again. But when someone develops leptin resistance, which can happen as a result of certain medications and treatments, they may feel hungry and eat more, even if their body has adequate fat stores. And so leptin is produced in the fat tissue. So generally speaking, the more fat tissue someone has, the higher their leptin levels are. So in leptin resistance, even though someone has adequate fat stores, the brain is just not getting the message that you're full. So I hope that made some sense. Right. So something else I want you to know is that stress can compound these metabolic changes, making weight management more challenging. So if you are watching this and you are a breast cancer survivor and you're like, I don't understand, like, my friends who haven't been through this, they don't have any problems with weight management. They're fine. Why is this so hard? You are absolutely not alone. And it's not in your head. I share this because I don't want you to freak out. It is not, having all of this in the mix, it does not guarantee that you are destined to be at a weight that is not comfortable for you. I share this because understanding what's going on, under the hood, behind the scenes, however you like to look at it, that can actually help you take steps that will make a difference in your journey. So a little bit about how our body responds to stress. So we have a very physical reaction. So you might notice that when you're under stress, you might feel those stress hormones like pumping through your system, right? Got adrenaline and noradrenaline and cortisol. And so you may experience things like increased heart rate, upset stomach, appetite changes. Those are all very, very common. Specific to breast cancer survivors, some things that may come up, and you don't need me to tell you this, but just I wanted to give some attention to this, is that, of course, the stress and anxiety related to diagnosis and treatment, the side effects of treatment, very stressful, loss of daily routine, financial stress, adjusting to changes in appearance, and then related body image issues. Of course, lifestyle changes, fear of recurrence, these are all very valid experiences, things that cause stress. So if you are dealing with any of these, don't beat up on yourself. This is all unfortunately, very common stressors that people are dealing with in this experience. So I share this because I want to make sure that there's some attention given to this, because we need to address these things. So across the board, some of the ways that stress can manifest. So, anxiety and depression can actually be related to chronic stress, digestive problems. This one goes unnoticed a lot of the time. There's a very strong connection between our gastrointestinal function and our emotional health and mental health. So, if you are experiencing digestive issues, that can cause stress, and stress can cause digestive issues. It's a two-way street. Of course, things like headaches, tension, muscle pain. This can often, if we may not realize we're clenching our muscles, clenching our teeth, that can also contribute to some of that discomfort. Also, things such as heart disease, heart attack, high blood pressure, stroke have been tied to chronic stress. Sleep disturbances, very common. Sleep and stress are very linked. We had a whole presentation on sleep. So if you haven't watched that one yet, I would invite you to check that out. And then weight gain. Weight loss can also be a manifestation of stress. It's a bit less common, but absolutely can occur. And then memory and concentration impairment. It is very hard to think clearly and function optimally when you're under a lot of stress. So it's not uncommon to find that words are not coming to you as easily, or you can't remember things as well. Okay, so what's oxidative stress? This is a term you might come across if you're reading articles about health and wellness. And like from a scientific perspective, just like basic definition, oxidative stress is a state in which there are too many or not enough there are too many free radical cells floating around in our body, but not enough antioxidants to fight them off, which can lead to cell damage. So it's kind of like getting like overrun with like these negative, compounds that are causing cell damage, and there's not enough of the good stuff to fight them off. Oxidative stress has been linked to increased risk of various diseases and adverse health conditions. So more specifically, oxidative stress, when there are other things in the mix. So you don't just have like oxidative stress like shows up overnight for no reason, right? It's typically caused or worsened by things such as obesity, poor diet quality, chronic physical or emotional stress, environmental factors, alcohol, smoking, certain medications. All of these things are contributing to the development of free radical cells and kind of disrupting the balance. So let's talk about this in the context of menopause. Now, this does not get enough attention at all, but and this is just scratching the surface, but it has been shown that postmenopausal women are actually more likely to have more of have like higher levels of what's called reactive oxygen species than premenopausal women. So this is an indication that oxidative stress has occurred. So higher incidence of oxidative stress, we could say. Additionally, menopause and its symptoms are associated with metabolic changes like loss of muscle, reduced metabolic rate, again, impaired glucose and lipid metabolism, which we talked about, changes in those hunger regulating hormones, leptin and ghrelin, increased risk of developing overweight and obesity, and higher levels of visceral fat. These are all things that are associated with menopause, whether or not somebody has cancer or has been treated for cancer. Um, so just to know that menopause, it can make things a bit more challenging. So again, if you are comparing your journey now to where you were pre-menopause, it's not that you're doing it all wrong or that you're missing the mark or something. It's just that there are changes that occur that we need to account for in our approach. Okay, it's like I said, but don't freak out. There are things you can do to decrease risk. So today we're going to talk about managing stress and improving the body's stress response. Now, I like to make this about stress management and not say stress reduction. I get so mad when I hear healthcare providers tell people to reduce their stress. And then that's like the end of the conversation. Like, how is that helpful, right? It's like, yeah, I'd like to reduce my stress too. Like, cool. But I think what's meaningful is what tools do we have and are we using those tools? I think that's what we should be focused on when we're talking about stress management. So let's start with nutrition. As a dietitian, this is a big part of what I focus on. And what we eat and don't eat can greatly impact our stress response and emotional state. So, just a few highlights I'm going to touch on. You want to promote blood sugar balance because when our blood sugar is well balanced, so we're having a good combination of protein, fat, and carbs spread evenly through the day, that is helping not just our blood sugar stay more stable, but it's also helping our mood stay more stable, our energy is more stable, our appetite control is better, and it's just helping our cells function better. And then gut health also matters. So there's a very strong connection between the brain in our head and the brain in our gut, which is you might see called the enteric nervous system. And the enteric nervous system and the central nervous system, they're in touch with each other all day, every day via the vagus nerve, which runs from up like in your back of your head all the way down into your down your back, and they're talking all day long. So there are, for example, mood regulating neurotransmitters, so mood regulating brain chemicals that are made in the gut, and the brain is sending signals all day for how to regulate like muscle and nerve function, and so it's all working together. So what's good for the gut, good for the brain. You can also incorporate specific foods with research-backed benefits, so compounds that have been shown to reduce the effects of stress. And then this is not people's favorite, but limiting alcohol and excess amounts of caffeine can also play a role in managing stress. So I'm not going to go too far down the rabbit hole here, but I did want to share this slide with you because these are some of the stress fighting foods and the nutrients in them. Like these are not, this is not an exhaustive list. This is not all of the stress fighting foods, but these are just a few highlights. So as you can see, it's a lot of the things that we turn to for disease risk reduction. So a lot of these polyphenol rich fruits and vegetables, healthy fats like olive oil and avocado and nuts and seeds, oily fish, so much going on there. Eggs, a lot of great nutrients to support cognitive function. On the plant-based side, chickpeas have a lot to offer with that fiber to nurture the gut, and tryptophan, which is an amino acid that's important for supporting good levels of a brain chemical called serotonin that helps us feel more relaxed. Things like oats and sweet potatoes have a lot going for them. And green tea actually has been shown to have antioxidants that promote relaxation and help you feel more focused and alert, but without the jitteriness of coffee. I'm not anti-coffee by any stretch, but I just wanted to call out green tea because we do have so much research on its benefits. So, okay, to go back to the blood sugar piece of the picture, as I mentioned, blood sugar balance is important for kind of keeping everything balanced. So you want to be eating protein, fat, and carbs spread through the day, and ideally choosing more complex carbs. So things like whole grains and sweet potatoes, and beans, peas, and lentils, things that have a lot of fiber, as compared to refined carbohydrates. So that would be like cookies and cakes and things of that nature. Also, limiting added sugar and sugary beverages can help because, and I would also put fruit juice in this category. When we consume very concentrated levels of carbohydrate, especially if there is not much fat, fiber, or protein to slow down the digestive process, that's like you're hitting your bloodstream with a really intense load of carbohydrate and asking it to work really hard to process it. So that is not going to be helpful for stable blood sugar and by extension, stress management. So I like formulas because they help us avoid overthinking. So I generally recommend at your main meals. So for many people, that's lunch and dinner. You want to aim to fill half your plate with non-starchy veggies, about a quarter of your plate with protein. Um, from a breast cancer perspective, risk reduction, we do recommend choosing the leaner proteins and limiting the red meat and the processed meat. Making sure there's healthy fat, because that's really important for blood sugar balance and nutrient absorption, and a little bit of starch. Totally, totally fine. I don't recommend going zero carb because one, that's kind of a miserable existence, but two, our brain needs carbohydrate to function. So it is okay to eat some carbs. What I want you to take away from this is when we're eating carbs, we want to pair them with protein and or fat to support stable blood sugar. And it's smaller meals. For many people, it's breakfast, but it does not. You can totally flip it over. You still want to have a combo of protein, fat, and fiber to keep you full, keep everything, help you feel grounded and help your body be more resilient against stress. And snacks, ideally, you want a combo of fiber and something with protein and or fat. So if you're someone that enjoys having an apple as a snack, you're going to get the most nutritional bang for your buck if you pair that apple with something like some almond butter or some nuts or something along those lines. So with gut health, I mean, we could spend a whole hour on this, but what I want you to know is that you want to be consuming foods that are supporting gut health, just to keep that line of communication clear between the brain in our gut and the brain in our head, right? So some of the foods I like to call out are fermented foods like yogurt and kefir. I do recommend going for the unflavored variety, so the plain. um, Also things like kimchi and sauerkraut, another great way to work in some probiotic bacteria. And then foods that contain prebiotic fibers. So prebiotics, they are a type of fiber that probiotic bacteria use as fuel. So, for example, if you're having yogurt, pairing it with some like underripe banana or some oat bran or wheat germ, those are all sources of prebiotics. Or, if you're making a dish where, maybe you're making a vegetable dish where you're adding some artichokes, and you're adding like some garlic and onions, which are prebiotic sources. And then maybe for the probiotic, you're adding some sauerkraut or kimchi to that dish. So when we combine these foods, we seem to get even more benefit than if we consume just one at a time. You can also consider a probiotic slash prebiotic supplement. I tend to favor supplements that have both because it just makes it easy to keep things continuously populated. When we eat fermented foods, they don't have, like, those probiotics don't have a super long life. And there's so many different types of probiotics that it would be really hard to cover all of your needs through just food. So sometimes I do encourage a supplement. Not for everybody. You always want to talk to your doctor, make sure it's a good fit for you, but they can be very useful. And then drink plenty of water. It doesn't matter how much fiber you're eating, if it's not moving, it's not going to do much for you. So drinking plenty of fluid is good for digestion, also good for, when our cells are well hydrated, they work better. So, and then movement, movement is also good for digestion. So taking a walk after meals, it's good for blood sugar, but it's also great for supporting healthy digestion and by extension, gut health. So I told you we talk about alcohol and caffeine. So what I want you to know is that they can disrupt our sleep and increase anxiety. I know alcohol, it has initially a sedative effect, but as our body metabolizes that alcohol, there are changes in brain chemicals like GABA that actually, when we experience a dip in those chemicals, we start to feel more anxious. So ultimately not super helpful. And also just to know that because of its impact on sugar or our blood sugar, consuming too much added sugar from like a sugary coffee beverage, that can also amp up anxiety. So, so for example, if you're somebody who tends to get like a sugary coffee drink on the regular, that might be a place to explore. Like a change you could make would be choosing something without as much sugar to help yourself feel a little more grounded. That's just one example. All right, so let's see. Let's talk about exercise. So you're probably well aware that alcohol, exercise is great for conditioning and protecting against disease, and actually it's been shown to promote relaxation, promote restful sleep, and also improve self-esteem and overall mental and emotional well-being. A lot of these benefits of exercise are believed to come from endorphins, which are hormones that are released during exercise. that help reduce stress, relieve pain, and boost our mood. So, okay, so how much exercise, right? This is like the magic question. And actually, the recommendations for stress management are very similar to those for reducing disease risk. So, it's generally recommended to aim for at least 150 minutes per week of moderate intensity aerobic exercise. So, you don't have to go above and beyond. Like, yes, there is a point where too much is too much. Like, I wouldn't tell someone, like, go for a long run every single day, because at a certain point, your body's going to think you're outrunning a predator and will respond by shutting down metabolism. But like, if you like to run, maybe you do a long run once a week, and other days you're walking, you're doing yoga, you're doing strength training, and you're, you know, working different muscle groups to help strengthen your body without draining you. But of course, life is busy, right? And hectic. And sometimes when there's a lot of demands on our time, it's hard to make time for us. So, some of the things that my patients and clients have found very useful are to do things like shorter bursts of activity. Research shows that this actually can be really helpful for protecting against disease. So, if, for example, even walking for like 5, 10 minutes after a meal, that's been shown to improve insulin sensitivity. You could also bake movement into your day, I like to call it. So, think of activities you're already doing. Like if you're on the phone a lot at your work or just as part of your life, you can walk, pace, ride a stationary bike, or use like an under desk cycler or elliptical machine on calls. Or you could consider something like a treadmill or a standing desk to encourage you to move more. You could also do something like keep free weights or resistance bands, maybe at your workspace, or if you have a ritual of watching TV at a certain time every day, like that might be a great time to, do some arm workouts or, resistance band exercises or ride on like a little bike. So that's all just kind of not looking for extra time, when you don't have time, but finding places where you could integrate movement into what you're already doing. If it helps, you could put it on your calendar, schedule your workouts, helps you it helps you both get it done, but it also seeing your own self-care on your calendar, it's a nice reminder that your health and wellness matters just as much as all those other priorities out there. Some of my patients have found it helpful to change into exercise clothes first thing in the morning or keep a change of clothes and shoes in your office or car if you work out later in the day, maybe after work or something. You could also exercise with a friend, a family member, or even a coach that you need to be accountable to. And of course, this should go without saying, but I'm going to say it anyway. Don't forget to choose movement you enjoy. I don't care if, some influencer on social media says like XYZ is the best workout. If you don't like it, it's not the best workout for you. All right, so we're not going to go too deeply into sleep. I would invite you to check out our lecture on specifically on sleep for more of a deep dive, but just know that stress can make it harder to sleep, and lack of sleep can make us less resilient against stress. So I'm just resharing some sleep hygiene 101 here. You want to keep your room cool, dark, and quiet. Avoid using electronic devices, ideally at least 30 minutes before bed, and keep your phone away, like out of reach, ideally, or keep it, if nothing else, face down, not in bed with you. You want to give yourself time to wind down before getting in bed and limit distractions. Also, consider a warm shower before bed or when you can't sleep. The reason that that works is that our body likes consistency, including with temperature. And so, if we are exposed to warm water, our body gets to work reducing our core body temperature, which can be very helpful for allowing us to drift off. Speaking of our body liking consistency, sleep routine is essential. So, going to bed and waking up at the same time each night, even on days off, like within about an hour, can be very helpful for training your body to know when it's time to sleep and when it's time to be awake. And then avoiding alcohol, caffeine, and heavy meals before bed. Really important for sleep, but also beneficial for metabolic health as well. So, a few other tools to consider for stress management. And again, you have to pick what works for you, but some of the research has pointed to things such as mindfulness and meditation, prayer, things like mental health counseling, spending time in nature, journaling, scheduling breaks for yourself, actually using your vacation time for vacation. And of course, asking for help, which I know can be really hard, and also planning what you can. We'll talk about that in a minute. I didn't feel like it would be right to tell you to look for mental health care resources without actually, giving you some insight on where to find that. So if you are feeling like a therapist would be a helpful resource for you, a few ways to find one. Ask your primary care doctor for a referral. Or if you're caring for a loved one with ongoing medical needs, you could see if their provider has information on mental health resources for caregivers. You could also ask your oncologist too. Some hospitals do have social work programs in place for patients, so please take advantage of those resources if they're available to you. You can also check your insurance website for local providers who are in network with your plan. And then there's online databases. So, Psychology Today is a pretty commonly known, robust database of therapists with all different specialties, different insurance plans. Locate you can search by location. So that is a great place to look for somebody in your area. And then there's also a lot more online therapy resources today that offer telehealth visits. So I would also encourage you to check that out. And of this list, these are, you'll find things available at many different price points and structures. So again, think about what you need and what would be optimal for you. So when it comes to making a stress management plan, we want it to be realistic. So the steps I often share about this are to identify first what you cannot control. So that way, take that off your plate. Not gonna, yes, maybe you don't like it, but it's not a thing you have to pressure yourself to change. Then identify what you can do something about. So once you know that, make a plan to address what you can control. And then get support from others. We often forget this step, but when we, get help from family members, maybe we hire help, friends, colleagues, it can help us be more successful in managing our stress. We don't have to suffer alone. And then I always like to add just make plans to deal with potential barriers to staying on track with stress management. I always say it's easy to, stay consistent with good habits when things are calm in your life, but how often is life really calm, right? So knowing where you are most likely to struggle actually allows you to focus on what will help you stay on track and feel your best during challenging times. So I would invite you to think about times when you struggled, maybe why that was. And that gives you some clues as to what support you need to put in place to help you have a different experience in the future so you can stay consistent with healthy habits. So, thank you so much for being here with me. I hope you found this helpful. And yeah, have a wonderful day.